If you're interested in brain health, you may be thinking about the developing brains of your kids, grandkids, or other young loved ones. It can be difficult when kids we love have excessive anxiety about greeting people, about being away from mom or being away from school, or even refusing to go to school. We may ask ourselves, what can we do about this? Is there anything that can help? So today's show will answer these questions. So stay tuned, because in this episode, you'll learn about a new way to approach anxiety in children, known as supportive parenting for anxious childhood emotions, or SPACE.
My name is Eli Lebowitz. I'm at the Yale Child Study Center, and I direct the program for anxiety disorders.
So I've seen your work mentioned in The Atlantic, in NPR, and then just this morning I was listening to your podcast on the Today's Mama podcast, which I thought was excellent. You've been really busy, so I've been wondering, why do you think there's sort of this sudden interest in your work?
You know, anxiety problems taken together as a group, anxiety problems are really the most common problems in mental health. So there's a great need for effective and efficacious treatments for helping these children. Current estimates are that about 1 in 3 children is going to suffer from a clinically impairing, diagnosable anxiety disorder by the time they reach adulthood. So the need is really terrific. And when not treated successfully, these are often what we think of as gateway problems, meaning that untreated anxiety can also lead to a lot of additional problems down the road, like mood problems, academic problems, occupational problems. So the need is really staggering. And I think that people are really recognizing this, and there's a great interest in anything new that can be done to help children with anxiety.
Sure. We seem to have a sense that when there is anxiety in a child, that it could relate to these future, issues, that it could be a gateway issue, like you said, with future issues with mood or with academic success, professional success. It certainly seems like that could be a big part of this. So for somebody who's listening that may have a child in their life, how could they know if their child has anxiety? What could be some signs that could point us to this?
That's actually a really good question. And one thing that makes it difficult for a lot of parents is that some anxiety is actually healthy, normal, and expected. Mm-hmm. We are supposed to be anxious some of the time. Our anxiety system is there for a reason, right? It's there to keep us safe, to keep us away from things that are actually dangerous. And sometimes we're going to feel anxious even about things that are not actually dangerous. And not everybody who's experiencing some anxiety in their life actually has an anxiety disorder. And so the first time your child comes into your room and says, I think there's a monster under my bed, you don't have to give that child Prozac, and you don't need to get them into therapy. But many children, as we were just saying, are going to suffer from really elevated, chronic, and impairing anxiety, and that's when it becomes a problem. So what are some things that we can think about in terms of detecting when is anxiety becoming an issue? Well, I would think about how much a child's anxiety, be that fears, worries, excessive stress and rigidity or perfectionism, all these different manifestations of anxiety, how much are they actually interfering with a child's ability to function normally in day-to-day life? Mm-hmm. Whether that is functioning in school, like attending school when school attendance resumes.
All right.
Whether that is maintaining relationships with peers, having friends, interacting with other people, speaking to other people. Whether it's family life that can be really impacted by a child's anxiety. Whether it's their own physical functioning, like their ability to sleep normally and to eat normally. Or whether it's just their mood, like how are they feeling and how much are they suffering. The more we start to see impairment, loss of function at an age-appropriate level in a child, and the more that problem persists over time so that it's not just 1 week or a day here and a day there, but becomes a more chronic issue that might last weeks, months, or even years, that's when we start to think this could be an anxiety disorder as opposed to the more normal and temporary anxiety that every child is going to experience some of the time.
Okay, so you're saying that anxiety is normal in certain, to a certain degree, but what we can look for in kids is whether there's impairment or a loss of function, or they're not able to attend school, or maybe refusing to leave the home, or unable to do things that we would expect a normal kid to be able to do in their life.
Right, right.
What are some of the sort of current options, or perhaps prior to SPACE, what were some of the options that would be available if a kid were to have anxiety and we were parents or a caregiver that was looking to give help?
For the past few decades, there have really been two main treatment options that have been well supported by clinical trial research. In other words, the kind of empirical, rigorous studies that provide the data to actually tell us that a treatment works. Mm-hmm. Those two treatments have been, on the one hand, psychopharmacology, meaning medications for anxiety. Mm-hmm. Without getting too deeply into the specifics of which medications, it is worth noting for those who may not be familiar with this area that the most commonly used medication to treat anxiety, whether in children or in adults, are actually, and somewhat confusingly, named antidepressants. And they're not named anti-anxiety medications, which is actually a different class of medication, which we don't recommend in most cases to treat anxiety. And that can be very confusing for a lot of parents, because you think, well, a child has anxiety, why don't you give them the anti-anxiety medicine, and you're giving them the antidepressant medication? But really, this is just somewhat of an accident and has more to do with the purpose that the medications were used for first, rather than what they are currently prescribed for. And in fact, antidepressants, which are recommended in many cases for anxiety, are also used to treat depression. And these are the Prozacs of the world. There are many different specific names. They're all fairly similar at the chemical level, and they function or they target a chemical that we have in our brains called serotonin. Now, medications can be an effective treatment for many cases. However, most researchers and many clinicians would recommend not choosing a medication as your first line of treatment, rather focusing on psychological treatments and only introducing medications when symptoms are either very, very severe or perhaps are not responding to psychological treatment, or there is some barrier to accessing psychological treatment. Mm-hmm. That's one of the two main treatments that has been well supported by research, is the medication option. The other is the psychological treatment, which is cognitive behavioral therapy, or as it's commonly known, CBT. The CBT is a psychological treatment, meaning a child could meet with a therapist and learn skills that can help in coping with anxiety. It's called CBT, or cognitive behavioral therapy, because the treatment focuses on helping children to change their cognitions, or their thoughts, and to identify anxious thoughts as irrational or unrealistic, to challenge those thoughts and practice changing those thoughts. And that's the C of CBT. And then the B of CBT stands for behavior, because the other and very important aspect of CBT for anxiety is practicing behavioral exposures. What we mean when we say exposures is for the child to practice exposing themselves to those things that are realistically not dangerous to them, but which they fear and avoid. Mm-hmm. And so a child and a therapist might work through a whole series of gradual exposures to objects or situations that the child fears and tends to avoid. And as they do that, the fear tends to go down so that they can get much better. And that's the psychological treatment of choice that's usually recommended for treating anxiety in children. And taken together, CBT and medication have really been the front line of treatment for these problems for many years now.
Okay, so for many years, the treatments have been CBT and medications. And so then what is space and how did it come about and how does it sort of compare to these two?
Well, space is also a psychological treatment. It's not a medication, right?
Mm-hmm.
It's a therapy done by a therapist.
Mm-hmm.
But it differs from cognitive behavioral therapy in some really meaningful ways. For one thing, and maybe the most obvious difference that's going to be apparent to every patient right away, is that space is actually a parent-based treatment. And so it's a treatment that's done not directly with the child, but rather by the therapist working with the parents to help the child to overcome their anxiety.
Mm-hmm.
And there have been in the past attempts and efforts to involve parents in treating childhood anxiety. There have been studies that have asked the question, can we improve the outcomes of cognitive behavioral therapy by also involving parents in the process? And somewhat frustratingly for those of us in the field who think this would make a lot of sense, actually most of those studies did not find that working with parents increased the efficacy relative to just working with the child alone. And so you might think, well, let's not bother then. Let's not work with the parents. What space does is to work with the parents, but to take a very different approach. In other words, to focus on a different aspect of child anxiety that was not really the center of previous attempts to work with parents. And the foundation for it is in the way that children respond to anxiety and the way that parents respond to their children's anxiety symptoms. Mm. Children, in many ways, respond to anxiety very similar to the way adults do, right? Their physical response might be similar, like the racing heart, or that dryness you might feel in your mouth when you're anxious. Mm-hmm. Even their cognitions and thoughts might be similar to the ways that in which an adult's thoughts might become distorted by elevated anxiety. But there is one way that children respond to anxiety differently from adults. And that really has its roots in our biological nature. Mm-hmm. And in the fact that we, meaning human beings, are mammals. Because mammals tend to respond to fear when they are young, not through an individual self-defense kind of response, the way that an adult might, but rather because children are inherently less capable of fending off threats independently, the mammalian response, and as such also the human response to fear and threat and stress and worry in childhood is actually to signal a caregiver who can then step in to provide protection and to provide regulation and soothing. And so children, when they are anxious, tend to look to their parents for help in coping with the fear, and parents tend to respond to those signals that their children give off. Once we start thinking about anxiety in children this way, it becomes very, very obvious that actually this is the way anxiety works universally in children. And we see that parents, almost in every single case, are deeply involved in their children's anxiety symptoms.
Mm. That makes a lot of sense. So in comparison to cognitive behavioral therapy and medications, SPACE, which is supportive parenting for anxious childhood emotions, is a psychological intervention, and it relies on the parents. It's a parent-based therapy because, like you're saying, we're mammals and our anxious response is to go to our caregivers. So therefore, it makes sense for the caregiver to be the point of the intervention. Before diving in a little deeper to what SPACE is, I've heard you before talk about the importance of addressing the issue of parent blame in this. And I thought it might be a good part to start.
I'm actually really glad that you brought that up. And if you hadn't, I probably would have, because it is such an important point. It is so
Right.
easy to make the leap from we can help children by working with their parents to parents are the problem, or parents have caused the anxiety problem in the first place. And that is simply not the case for the vast majority of cases. And I'm also keenly aware of the fact that mental health as a discipline, as a profession, has a rich and somewhat shameful history of blaming parents for children's mental health problems. That has happened for over the years for many different problems. Parents have been blamed in the past for schizophrenia, a very serious mental illness that parents do not cause. Parents have been blamed for autism, a serious problem that parents do not cause. And so it's really important to be very clear that simply because it's possible for parents to help their children with a problem does not mean that parents have caused the problem. Once you think about it that way, it really seems obvious that there's no reason why it would be the case that you would only help your child with a problem if you had caused it. We help our children with any number of problems, whether directly or by taking them to a doctor to help them. And that does not mean that we as the parents caused the problem in the first place. There is not evidence to support the hypothesis that parents are the cause of children's anxiety problems in the vast majority of cases. And so it's a really important point that I appreciate you bringing up.
Yeah, even though they may not be the cause, they can certainly be a part of the treatment, part of making this better, which is exactly how space works. So, so let's go ahead and dive into how does space work? How do we, utilize the relationship with the parents or the caregiver to be able to help a child with their anxiety?
Yeah, so we were talking about how parents become involved in their children's anxiety problem. And probably the main way that they do become involved is through a process that we call accommodation, family accommodation of the child's symptoms. And what family accommodation really means is all those ways in which parents change their own behaviors in order to help their child not feel anxious, or to help them feel less anxious when they do feel anxious. And so there can be any number of examples of accommodation. For example, if a child is socially anxious and has difficulty speaking to other people, it's common for a parent to speak instead of them. So you might be at the restaurant with your child and they don't feel comfortable speaking to the waiter, and so you might speak in place of them. Or if a child is anxious about being separated from parents and is scared when they can't see the parent, you may stay near them. You may sleep next to them at night. Or if a child has generalized anxiety, which is really chronic worry, they may ask you, the parent, any number of questions relating to their worry, and you may answer those questions, often repeatedly, often seemingly endlessly, in an attempt to help your child feel less anxious. And so these are a big part of what space focuses on, because what we know about accommodation is that even though almost every parent who has an anxious child will be accommodating, that accommodation is actually not very helpful over time. It helps in the moment to help a child to feel less anxious. Your child is worried, they ask you about their worry, you answer them, and momentarily they may feel less anxious. However, in a few minutes, they're going to be back with another question. And over time, those accommodations can actually maintain a child's anxiety rather than alleviating it, so that more accommodation actually ends up predicting more severe symptoms in the child and more impairment for the child and for the whole family because the accommodation really places a burden on everyone in the family. The parents may be expending tremendous resources in time, energy, sometimes money, in trying to accommodate the child. Often siblings are paying a price for the accommodation that parents are making for the anxious sibling. In space, we really try to do two main things with parents, and both of them are focused only on changing the parent's own behavior. So parents who are treated with space, or children who are treated with space through their parents, when parents go to the treatment, there's no expectation that they be able to directly change their child's behavior. They don't have to go home and make their child stop asking the questions or stop washing their hands repeatedly, as in obsessive compulsive disorder, or sleep alone in their bed. And this is really important because when you ask parents to directly change the child's behavior, what can sometimes occur is a lot of conflict between the parent and the child. The parent tries to enforce this expectation. The child may resist it. And then what ensues is actually conflict and escalation between them that not only is not useful for reducing anxiety, but can actually be detrimental to the whole family system. And so there are two things that we do help parents to do, two kinds of changes that parents do make in space, but they're both only about the parent's own behavior. The first of those two is to increase supportive responses to the child's anxiety symptoms, to help the parents to be more supportive in responding to their child's anxiety. And what we mean by a supportive response is really any response that conveys to the child two very important messages. One is a message of acceptance, of validation and acknowledgement of what the child is genuinely feeling. That might be as simple as saying to the child, I get it. I understand how hard this is for you, how scared you feel, or how uncomfortable this makes you. Some explicit acknowledgement and acceptance of the child's genuine distress. The second ingredient in this very simple recipe, it's just a 2-ingredient recipe. The second ingredient is confidence. It becomes a supportive message when it has that acceptance, but it also conveys to the child a message of confidence in the child's ability to cope with anxiety, to tolerate feeling anxious some of the time, and to get through that. And that might be as simple as saying to the child, I think you can handle it. I'm sure you can be okay. So you put the two together into a statement that might sound like, I know this is really hard for you, but I'm sure you can handle it. And that's when you get a supportive statement. So parents in space will learn how to make these supportive statements, they'll practice them, and they'll go home and start responding to their children's anxiety symptoms with supportive responses. And that's the first of the two things that we help parents to do in space treatment. The second thing has to do with the accommodation that we were just talking about a couple of minutes ago. And that is to systematically reduce the accommodations that parents are providing. And so in space treatment, therapists will carefully map out with the parents all of the different ways in which they are accommodating. And those might be any number of things that they are doing or that they're purposefully not doing because doing it would trigger the child's anxiety. And so they will map out these accommodations and then think carefully and choose a specific target, one thing that parents will start to reduce. And we don't ask parents to just stop all accommodation because we know that's generally not possible and will lead to inconsistency and lack of persistence in the parents. And so we'll choose one thing, and then parents will make a very detailed plan with the therapist for how they're going to reduce that accommodation. What are they going to do differently? when are they going to do it, how much, etc. They'll communicate that plan to the child in an open, clear, and supportive manner. And then they'll start implementing their plan and reducing the accommodation. And when they've been able to do that successfully and that accommodation has gone away or has gone down significantly, they'll take the next step, which might be further reducing that accommodation or taking on another accommodation to reduce. And what we find is that when parents are able to work through this treatment and do both of those things to increase the supportive statements and reduce their accommodation, children's anxiety will go down. And often children will be in remission, meaning they will be cured of their anxiety disorder.
Awesome. So just to summarize, so this parent-based treatment, it is enacted upon by first increasing those supportive responses to the anxiety symptoms. And you said you can do that with an acceptance statement followed by a confidence statement. So saying something like, I know this is hard for you, and I know you can get through it. And then also at the same time, systematically reducing the amount of accommodations that you're making for your kid, starting, presumably this would be one-on-one with the therapist, and you're going sort of one at a time of one thing that you're trying to reduce accommodating. I would imagine, knowing a lot of parents in my life, that they'll foresee a lot of, anger or tantrums or, difficulty with this. Do you have any sort of words of encouragement or ways to sort of weigh about how far you can push it before it's too much?
Yes, that is a good point, and you're not wrong, that not all children respond to the parents reducing accommodation with happiness or gratitude in the very short term. Some children might get distressed. Some children might get angry or even aggressive. Some children might accuse the parent of not loving them enough or not loving them anymore. Some children may even threaten to harm themselves if parents don't resume accommodating as they've been used to. That can be very hard. Fortunately, it does not surprise us because it's a predictable set of responses in the child, and included in space treatment are a set of tools to help parents to cope with those responses in ways that are loving, that are supportive, that maintain positive relationship with the child and don't escalate those behaviors or those conflict, but that also allow them, that also allow them to continue the process of treatment. Now, I think a really important point to make is that in most cases, once treatment proceeds a little bit, if parents are able to persist despite that initial difficulty, very soon that resistance or anger can transform into a lot of hope for the child. Because from the child's perspective, it starts to feel like I actually am getting better, like my parents actually do know how to help me and can help me to overcome this problem. And so that initial resistance and frustration or anger can very quickly change into hope for feeling better and being less anxious. But absolutely, we have a set of tools in space in order to cope with those difficulties because they are foreseeable.
And so speaking of the kid getting better and noticing their anxiety being better, there has been evidence that space works. I saw the article in the Journal of the American Academy of Child and Adolescent Psychiatry in 2019, which was a randomized non-inferiority study that showed that it was non-inferior to cognitive behavioral therapy, which we talked about before. You also had a case report in the Bulletin of the Menninger Clinic about OCD treatment for this. Could you talk a little bit about how we know that space actually works for kids and their anxiety?
Yes, and it's a very important question because if we're going to do a treatment, we need to know that it works.
Right.
And actually help families to get better. And so the evidence for the efficacy of space has been building and mounting step after step, as is always the case for any newer treatment. And so You mentioned some studies, there are some additional studies. You generally start building this kind of an evidence base by doing smaller studies, case studies and open pilot trials. And those are very useful for teaching us about the feasibility of the treatment. They can answer questions like, will families actually do this? Will they keep coming back? How many drop out? Do they feel satisfied by the treatment at the end? But they're limited. That kind of study is limited in its ability to actually answer the efficacy question, for which you really do need randomized controlled trial research. And so that is the other kind of study that we have been doing and that has been published. And so the study that you mentioned from 2019 was a sizable randomized control trial with over 120 children who were randomly assigned to receive either 12 weeks of cognitive behavioral therapy, the current frontline evidence-based psychological treatment, or to receive space. And children who were randomly assigned to receive space actually never met with the therapist. They were assessed and evaluated by independent evaluators who were blinded to the treatment condition that they were assigned to, but they actually never met with the therapist. And what we found was that the results for both treatments, for cognitive behavioral therapy and for space, were completely comparable, meaning that cognitive behavioral therapy was no more effective at reducing the child's anxiety than was space. And what is remarkable, I think, is that those results held across the various indicators of anxiety that we looked at. And so whether we were looking at our independent evaluator assessments, or we were looking at parent ratings of their child's anxiety from before to after treatment, or whether we were looking at the child's own ratings of their anxiety symptoms from before to after treatment, across all three of those, the two treatments were essentially equivalent. And that, I think, is remarkable because when we look at the child's ratings, we're actually comparing children who received 12 weeks of therapy to children who never met with a therapist.
Right.
And yet they were still equivalent in their outcomes. And what we also found was really high satisfaction for the treatment, for space, from both parents and children. So we're continuing to do additional clinical trial research. We're doing a clinical trial at the moment, which is actually really interesting in part because we are not only doing the clinical trial part, but we're also using functional magnetic resonance imaging, or fMRI, to actually study changes in children's brains from before the treatment to after, so that we can learn about what actually changes in the way a child's brain processes fear when parents receive this treatment. But we're now at a point where we can say with a good amount of confidence that this is another efficacious treatment to add to our toolbox of ways in which we can help children with anxiety and their parents.
Do you have any other sort of guiding thoughts for listeners to this podcast that may think, I want to implement this, or I want to get involved a little more?
Yeah, I think the interest in both the professional population, meaning psychiatrists and psychologists and social workers and teachers and pediatricians, has been tremendous. And we conduct training workshops for providers who want to learn, how can I learn to do space with my own patients? Those workshops have been packed with long wait lists, and it speaks to the thirst that is out there for more effective, for additional effective tools for helping families, and providers who are interested in getting this kind of training should go to the website spacetreatment.net. Spacetreatment.net And there they can get information on upcoming training workshops or add their email to a list to be informed when additional workshops are planned. There's a forum on the website where they can interact with other providers, and that's a very good resource for professionals. But parents are also tremendously interested in this. Parents who might listen to a podcast like yours, or read an article like the one you mentioned in the Atlantic, or any of the many, many articles that have come out about this treatment, are also very interested. And they can also go to the same website, to spacetreatment.net, where they can find a list of trained providers. And they can search by their area. So who in my state, for example, has already learned how to do this treatment so that they can contact somebody and get this kind of help. And then the other thing to mention is, in addition to articles describing the treatment and describing the research, there are several books that talk about space or related information. Those can also be found on that website. And there's even a parent workbook, so that a parent who might not be able to access treatment directly with a therapist for one reason or another, or a parent who thinks maybe the problem is not quite so severe and I think that I can handle this on my own, but I need some guidance on how to do it, or I just want to give it a go, can actually learn to implement space on their own. And that is a new book, actually, that is now pre-orderable and not yet shipping, but I think will be a very important resource for parents who want to learn more about this and want to try to help their child in this way.
I'd seen that book on the website, Breaking Free of Childhood Anxiety and OCD. That's one you're referring to, correct?
Right, yes.
Awesome. So lots of information there on spacetreatment.net, and perhaps just from what you've learned in this interview, that the two tenets of implementing space is increasing those supportive responses to anxiety symptoms. So a statement of acceptance, so something like "I get it," or "I know this is hard for you," and then a statement of confidence, like "I think you can handle it," or I know you can get through it. And then the second part being systematically reducing the accommodations, maybe choosing one thing that you notice in your child's life that causes them anxiety and trying to reduce the accommodation that you're making to that by, you had said before in the example of encouraging them to speak up and place their own order at a restaurant or something like that, instead of you accommodating for them. Do you have any other last hints or tips in the daily life how a parent could implement it?
I think the way that you just summarized it was well said. I think we have to be accepting of the fact that children are going to be anxious some of the time, and that is going to be true for every child. And for a lot of children, they're going to be anxious a lot of the time. And so coming at it from a genuine place of acceptance, but remembering that one of the most important things for a child who is vulnerable to anxiety is actually believing that they can handle anxiety. Mm-hmm. And so often our responses, well-intentioned responses to an anxious child, actually convey the opposite message. We try to comfort or we try to reassure, but we're sometimes giving the message, I don't think you can handle anxiety. And if your child is vulnerable to elevated levels of anxiety, then they're going to be handling a lot of anxiety for the foreseeable future. We don't have, not the medications, not CBT, and not space, none of these can inherently change that underlying susceptibility and vulnerability to anxiety. And so if your child is vulnerable in that way, they're probably going to deal with a lot of anxiety over the course of their life. And one of the best gifts that you can give that child is the belief that, yes, it does feel uncomfortable. It sucks to feel anxious, but I can handle it. And so making that an important an important objective to reflect that to your child, not demanding that they overcome it right away, not expecting them to listen to that statement and immediately stand up and change everything about their symptoms. That's not reasonable. But the cumulative effect of you showing them that you believe they can handle it can deeply change their belief about their own ability and capacity for tolerating anxiety. So if you're with that child in the restaurant, you don't even need to try to make them place the order. You don't need to try to get them to speak. You can just tell them, I get it. I know that it's really uncomfortable for you to speak with the waiter, but I am so sure that you are able to handle that discomfort, that you can be okay even though it's uncomfortable, that I'm not going to do it instead of you. And maybe they won't order that first time, but maybe they will the second time or the third time. And that's what we see happening in space. When you do it the first time, your child might not immediately behave differently, but when you're able to consistently give them the message of support and to back it up by not doing the accommodation yourself, pretty soon the child comes to believe that and will actually take that next step forward. And when they do that, that sense of pride in themselves for having accomplished something that was hard, and they're learning that in fact it's true, I can get through something that makes me uncomfortable, is, I believe, one of the best gifts that you can give to any anxious child.
Well, certainly with the results that you've been showing in the studies, I think there's a lot to be hopeful about with this. So certainly a message of hope that you're bringing, and I really appreciate that, and I'm sure our listeners will. So one way that I like to end the show is to ask you personally whether or not you found anything in your life that has been good for your brain health.
I don't think that I found something that is not known, but I do find that what is known seems to work for me as well. And that, in my case, is keeping your brain active and versatile, meaning that keeping it active by engaging in things that stimulate your thinking, and versatility by having different things, flexibility. So for myself, I'm 44, I think, years old. A year ago, I decided to learn a new language. Wow. Because that's a great way to practice mental flexibility, right? Languages have different structures and different patterns, and what works in one language, especially, personally, I'm learning Japanese, which is very, very different from the way other languages I'm familiar with work. And so keeping up that flexibility. So whether it's a language or whether it's a crossword puzzle or whether, it's the books that you read, I think that keeping yourself stimulated and engaged and in more than one area is, for me, I think the thing that keeps my brain most healthy. On everything else that you mentioned, I'm very much a do as I say and not as I preach. I don't sleep as much as I should. I'm not as physically active as I probably should be. And you probably should not follow my role modeling for most of those things that you listed. So I recommend them, but can't say I do them quite as much as I should.
Well, certainly the remaining cognitively active and I think the diversity piece is something a lot of people miss, especially with aging, of trying to keep that diversity of thought, diversity of activity and behavior as being something to keep the mind active and young. So I appreciate you sharing those thoughts. Well, as you've already shared, people can find more about SPACE at your website, which is spacetreatment.net. There you can find the books, you can find some articles, and more ways that you can get involved.
Thank you for taking an interest in this and helping to bring this information to more people, which is really the goal of all of the work that we do, that I do, and that the Child Study Center here at Yale does, is helping as many families and as many children as possible and bringing as much information to as many people as possible.